Good afternoon and welcome to Bariatric Friday. My name is Kemal Erkan. We are going to discuss general surgery and minimally invasive surgery rather, and of course with the general surgery following. So Dr. Irgau is going to join me. Dr. Irgau, how are you doing?
I am doing great. Very happy to be at another session of Bariatric Friday. Talk about a very important topic.
It's always good to have you. So we are going to discuss the general surgery, as general surgery encompasses a wide range of procedures. Now, we did cover this before with a couple of our other surgeons, but what I realize is that as we do so much work on the bariatric side, and I believe it's been explained very well, but then I see similar issues for general surgery, and we wanted to actually give the best information for our audience and common surgeries and what are the key factors for prevention and what are the techniques these days. And also, of course, we have two brand new surgeons started, so they covered some of these as their education, clinical training comes from there as well. So let's start with the first question. What are the most common conditions treated in general surgery, and what symptoms should people not ignore?
Absolutely. So before answering that question, I would like to add to what you said about the importance of general surgery, come out particularly to us at CRIAS, Christiana Institute of Advanced Surgery. And what I want to stress is that, yes, we do bariatric surgery and we are known for that, but we're actually general surgeons by training, which means that our foundation is general surgery. And it's important to clarify that because I do see patients from time to time who come for bariatric follow-up and then they tell me, oh, I have a hernia, I'm going to see a general surgeon. Do you know one? Meaning that they probably are not aware that that's actually part of what we do day in and day out, general surgery. Going back to the question that you mentioned, general surgeons essentially deal with a fairly wide variety of diseases and problems, very often centered around what can happen in the abdomen. So we're talking about hernias, for instance, we're talking about gallbladders, we're talking about problems with the colon, with the intestine, things like diverticulitis, for instance, appendicitis. These are all within the realm of general surgery. And in terms of, what are the warning signs for problems that can occur in the abdomen, whether it's the gallbladder, whether it's diverticulitis, appendicitis, people need to understand that persistent abdominal pain, for instance, should not be ignored. That's an important sign. Unexplained nausea or vomiting. If people have a fever and they have tenderness in the abdomen, in other words, if they touch their belly and that feels sore, that is an extremely important sign that cannot be ignored. Obviously, if they have pain and it worsens, they shouldn't ignore it. Just taking pain medication is wishing for it to go away is not enough. It is important that persistent pain in the abdomen is abnormal and needs to be investigated.
Right. So the elective surgeries are planned, and if they're planned, it's safer. So many of the general surgeries ends up in the emergency, and that actually brings higher risk for patients. So why is early diagnosis so important in general surgery?
It is very important because with early diagnosis, prompt treatment can be rendered, and that can be done in an elective fashion. And as you mentioned, elective surgery is surgery for which you prepare, right? As opposed to emergency surgery. Emergency surgery is something that can happen at 2 o'clock in the morning, right? When the facility is not at its best, essentially. The patient also may not be at their best. For instance, they may have been sick for a while before they decide to come to the emergency room. So they could be malnourished, they could be dehydrated. So their body is at their weakest, essentially. And the disease itself would have advanced to a level that taking care of it now could be fraught with complications. So a good example is gallbladder problems. For instance, we see very often people who have gallbladder problems in that they will have pain after they eat, they have nausea and vomiting, that goes away, but they ignore it. They think maybe it's indigestion, it's something that will go away, and that may happen several times. Now, at some point, they may have such a severe symptom that they are forced to go to the emergency room. Well, that may mean that their disease now is very acute, and they may have what we call acute cholecystitis, right? And they may require surgery in an emergency fashion. And surgery in an emergency is never ideal because, as I said, it's being done in a setting which is not optimal. Nighttime, for instance, right? When hospitals
Surgeons are not on site.
Surgeons are not on site, and the hospital also keep stuff that is going to be appropriate for nighttime, essentially, right? And the patient themselves may not be in their best shape when they come for emergency surgery. They may be, their body is very weakened, they're malnourished, as I said. So really, when you look at surgery that is done in an elective fashion and surgery that's done in emergency fashion, you would see that the complication rate is much higher with surgery done in an emergency setting.
Right.
As the recovery from that surgery could also take longer. For instance, if you see gallbladder surgery, as we may talk about in a minute, is done nowadays laparoscopically, which means we use very small incisions and undertake that procedure. Now, when we do that procedure, Kemal, there is always a possibility that we have to resort to changing that to open surgery, right? Well, what are the chances of having to do open surgery when you're doing elective gallbladder surgery? Well, the chances are extremely low, less than 1%. But if you're doing emergency surgery, the chances for having to do open surgery are much higher because there may be too much inflammation, right? Making laparoscopy much more difficult to do. So always it's important to really listen to the warning signs and seek help early rather than wait for the disease to progress to a level where emergency surgery may be required.
So the other thing, I guess it's important that we have certain clearances that we are going to need. If it's done in the elective setting, then we are able to get the proper clearances. And if it's in the emergency, timing is running so fast and you don't have a lot of time.
Absolutely.
And I think let's elaborate that because the part of the issue I want our audience to understand is you said something about facility not being at their best at, let's say, at night. And I may have given this example before, but like one of our biggest hospitals, Christiana Care, so 20 ORs, that 20 OR goes down to 10 at 5 p.m.
Yes.
And it goes down to 4 until 11. And
I believe so.
11 is 2.
Yeah.
Now, why I know this very well is because Surgeries for Emergency Care, the entity that you and we started, and where we had surgeons on site.
On site, yeah.
And then the issue was, we got this from the hospitals. They're saying that, hey, we really don't want you to do surgery at 2 in the morning. If it's not, super urgent, just wait until tomorrow. We are like, well, you don't want this to be done right away, blah, blah. And those are the times that I may not be up to date with everything. And they're like, well, we don't have nurses. Or we have to keep the other OR for the trauma cases. And you don't have the technicians on call and on site.
Yeah.
So that's why for patients to help with the early diagnosis, they need to watch their symptoms. And we've been talking about like the internet, the AI and all that. So you can, I don't want anyone to self-diagnose themselves, but I want them to run their symptoms through the system, through the AI, and see what may be happening and if they need to go sooner. So I know one of our people recently, she's a gallbladder, and she was in the hospital before the surgery for 2 full days.
Wow.
And if we were to get those symptoms early on, and if she was to come to us, we would be able to do her case electively in the surgery center, and things would be much better for the recovery. Now, speaking of gallbladder, Dr. Irgau, we know that gallstones can block bile flow and then cause inflammation. So This is sometimes people have no symptoms, and others may have symptoms and repeat attacks of pain and digestive issues. So, what causes gallbladder problems, and when is surgery necessary?
So the vast majority of cases, gallbladder problems arise due to the presence of gallstones. And with that, there is continuous inflammation of the gallbladder itself that leads to dysfunction of the. When that occurs, people experience symptoms. And the typical symptoms are pain in the right upper side of the abdomen, right? So just underneath the rib cage on the right side, that's where typically the pain is. But it could be on the flank, it could be in the back, and very often the pain could even radiate from the front to the back. Typically, this occurs right after they eat something that has fat, right? So fatty meals, fried foods, desserts, ice cream, things like that will trigger the pain when the gallbladder is diseased. Very often they may feel a sensation of bloating as well, which is fairly common, and they may have a sensation of sickness like nausea or even vomiting. So these are the symptoms that can occur with gallbladder attacks, and sometimes the attacks can be so severe that people have to seek emergency care, but very often they will be recurrent type of symptoms that will occur in this fashion. And if people have those, it's important for them to have this checked, in a timely fashion, because the treatment can be done without having to wait for an emergency situation, just to avoid the problems that you just mentioned.
So, one of the other really common general surgery that we see is hernias, and
Yes.
hernias have several different types. And this is also, in many cases, with the internal tissue pushing through a weakened area in muscles, and it can be very painful. And I know a couple of people who just didn't do anything, a couple of my friends for a while, and it became a big problem for them. So, how does the hernia form, and when do they become dangerous for the patients?
So the most common type of hernia is what we call abdominal wall hernia. So the hernia is the result of a weakness, or even you can call it a hole in the muscle itself. Now, the muscle has to be strong enough to make sure that structures that are inside of our abdomen don't push through when we are straining, like when we're coughing, when we are going to the bathroom, when we are laughing. Those structures stay put because the wall of the abdomen is strong and it has integrity. But when there is weakness, when there is a hole, those structures will tend to push through that weakness, and the person will experience a bulge through that area. One of the common places for this to happen on the abdominal wall is the belly button, for instance, because it's a natural area of weakness of our abdomen. Another area is the groin also. So those are hernias essentially, and the situation can become dangerous if some of the structures like the intestines push through but then refuse to go back, and they are stuck in that position. And if they are stuck and then start having problems with their blood supply, that can actually lead to a very dangerous, even life-threatening condition essentially. So hernias are common problems, and people should not wait for these problems to become emergencies. Again, if they see a bulge in an area, which is very often uncomfortable, as I said, the commonest places would be around the belly button and in the groins, then they should seek care at that time as well.
And the other thing, again, people need to remember when they feel like things are going to be better and they don't want to go to a surgeon visit in the outpatient setting, then what happens is something that can be done in the outpatient setting. Now it has to be done in the inpatient setting. In the emergency setting, the bill will be 6 to 8 times higher than what it would be if it was in the outpatient setting. So you are not really saving any money if you are delaying this. Potentially, you are going to end up spending more, especially with the deductibles and the out-of-pocket pays and the overall co-insurances. So this is the best if you take a timely action.
Absolutely. And then the other thing to remember about hernias, Kamal, is that if a hernia occurs, unless it's fixed, it never goes away. It will be there. And the most likely scenario is
So
that
it
it will
doesn't
get
get better.
It doesn't get better. I
Right.
mean, if there is a weakness in the abdomen, unless you fix it, it is going to remain there. But more importantly, it could get worse, particularly because hernias tend to get worse with obesity, for instance. So as people gain weight, it's just going to get worse and worse, essentially. So having it fixed, having it checked and then fixed early makes a lot of sense.
All right. Did you guys hear this? So if you have hernia, just have an appointment.
That's right.
All right. So diverticulitis. Sometimes that doesn't come out in one try, but this time it did. Thank you. So this is one of the dangerous, even like more than gallbladder and hernia, um, for the patients and for anyone who's having these. And this is this causes lower left abdomen pain, fever, and changes. And this is an inflammation with the small pouches in the colon. When you explained this to me several years ago, I had this really clear understanding of what I needed to do. I don't have that, but this doesn't mean that I won't have it. What people need to do and how they can actually be taking actions on the prevention. So, and just so that I have the actual topic questions out. What should people know about diverticulitis?
So, first of all, diverticulitis is an inflammation of diverticulosis. Now, diverticulosis by itself is a very common occurrence, particularly in Western societies where the diet tends to be very poor in fiber. These outpoachings that occur in the large intestines are very common, particularly after the age of 45, 50. And so it is not going to be surprising for people undergoing a colonoscopy, for instance, for other, for screening purposes, and their surgeon to tell them, hey, you have diverticulosis, which means that they have these little pouches. Now, diverticulitis occurs when these pouches become inflamed. If they become inflamed, then suddenly they are painful. Very often, the inflammation is mild and it can be taken care of without any surgical intervention, just by going on a fairly, liquid diet and then low residue diet and then some painkillers and perhaps some antibiotics as well. When these attacks become much more frequent, or the pain is severe, the inflammation is so severe that now, for instance, some of the contents of the intestine have leaked out into the rest of the abdominal cavity, that is a much more serious situation, potentially life-threatening. And those situations might require surgery to remove that portion of the intestine that has those little outpoaches that could become inflamed in the future as well.
So again, they're there. So then inflammation can happen. So that happens because of the way that we eat.
So the way that we eat leads to the formation of those pouches. So you can have somebody having those pouches without having any symptoms at all. And they would know they have those pouches because they've had a colonoscopy or they've had a CAT scan and we see them, right? But when those pouches, those pockets, those abnormal pockets become inflamed, then you have diverticulitis.
That part, so inflamed part. So because these pouches can collect.
Yes,
right?
Absolutely.
So they're almost like little pockets in the colon. So then what's going to stay there is anything that's going to be hard and not having enough fiber, and then like things are not flowing in the colon.
Absolutely,
right?
absolutely, yeah.
So I remember when I was reading about this several years ago, and then for some of the other sessions, it's easy to prevent, but it's not going to happen overnight. So this is something that comes with our diet, our lifestyle, so that there is that good flow that happens. So then those pouches are not picking those little things, and then it becomes more major.
Absolutely, absolutely. So the key here is that having a diet that is rich in fiber is important for many reasons, including the prevention of this type of problems. First of all, the chances of forming the pouches itself is going to be less if a person has a fiber-rich diet in general. But when they know that they have diverticulosis, in order for them to prevent inflammation, they should go on a high fiber diet. So I did do a few colonoscopies this morning, for instance, and at least a couple of the patients that I did have diverticulosis, those pouches. And my recommendation for their diet afterwards was for them to go on a high fiber diet.
So this is like fruits, vegetables, beans, and whole
absolutely.
grains.
Those healthy things that we tend to avoid in the Western diet, essentially, those are really critically important. But
Well, they don't necessarily avoid them. They eat them on top of everything that they have. So not, not a replacement, but it's like, I'm going to have everything bad, but I'm going to have some berries.
so
So now I have a healthy diet.
they're not central in the diet. That's the problem. But going back to diverticulitis, so as you mentioned, and one thing that I want to emphasize is if a person has pain on the lower part of their abdomen, particularly on the left side, that is a possibility for diverticulitis. And that's the kind of pain that they cannot ignore. Sometimes I've seen patients say, hey, I thought this was constipation. I took some laxatives, and that makes things a lot worse, actually, leading to potentially things to burst as opposed to get better. So when they have this type of problems, it's important not to ignore them. Those things are never, that pain is never normal, and seeking medical attention is very important.
And these urgency on this one can elevate to a really deadly issues.
Absolutely. I mean,
cases.
sometimes if this problem becomes really severe, a surgeon may need to remove that part of the intestine, but because everything is so acute, they may not be able to put the intestine back together, and that person may have to have a bag on their abdomen for some time, which really leads to a lot of potential complications, essentially. So this is coming from not really acting early, right? So if they have a problem, and that's the theme of your talk today, right? If you're having some problems, don't ignore them. Get help early enough.
Absolutely.
Yeah.
Now, again, we are gonna say what's right. Doesn't mean that if we do everything right personally, but we can tell others to do the right things with the right way. So I was just going from the personal side. So I may not be the best patient for our physicians. I know.
Well, most physicians are not best patients either. So,
appendicitis is one of the very common emergency surgery, and this is an inflammation of the appendix, and so the pain starts with the navel and then shifting lower right
right side, yeah,
right abdomen,
yeah.
and this is also very common, and it can be severe if it's not taken care of. Now, what are the signs of appendicitis, and how can we eliminate the surgical emergency?
So essentially, appendicitis usually presents with pain that starts as a vague pain around the belly button, and then it localizes on the right side of the lower abdomen. That is really the classic presentation of appendicitis, and then the abdomen will be tender to touch on that side as well. Nowadays, the vast majority of people who have the symptoms, they will go to the emergency room, and very often a CAT scan of the abdomen will be done, which will aid in the diagnosis. It is one of the most common general surgical procedures that we do. It's a common problem for general surgeons. Nowadays, the treatment is fairly straightforward. It's done laparoscopically. Very often, when people present with that problem, they will have the surgery and go home within the same day, even in hospital settings very often. The one thing that is important to understand, Kemal, and it's important to emphasize this, is that appendicitis used to be a big killer in the past, and it still is in many parts of the world. It still is in our country as well. Not obviously frequently, but to really emphasize the point that unless it's taken care of readily, this can become a disastrous problem, because the appendix can burst, and bursting of the appendix can lead to infection and inflammation of the rest of the abdomen, changing what would be a very easily taken care of surgical problem into a disaster for the patient that would lead them to be in hospital, even in the intensive care unit, for a very long period of time. So appendicitis is something that cannot be ignored. Again, it should be taken care of promptly. Now, very often, people actually get so much pain that they will present to the emergency room fairly rarely with appendicitis.
But that pain builds up.
It
so
does
then we are
build up,
ignoring
so
it.
it's important not to ignore it.
And
It is
part of it is, I mean, sorry,
Sure, of
part
course.
of it is because it's kind of targeting the young men, and men are the worst patients when it comes to going to the help that they need. We know this from other programs as well.
of course.
So including us. So we are not an easy one. We don't listen and we do dumb stuff, and this is because it's hitting the 25 years up and down. That's the kind of the disease actually targeting that group. So that's why probably many of the complications come from there.
In fact, clearly appendicitis is generally a disease of the young, right? It occurs in that age group that you mentioned, essentially. But another thing to emphasize here is that appendicitis can occur in a later life as well, right? So, but very often, if it occurs in later life, appendicitis is associated with a cancer of the appendix. So it is even more important not to ignore appendicitis that occurs later in life, essentially. So very often it's a disease of the young, but if it does occur later in life, it could be associated with cancer, and it's important to address that promptly as well.
Now, laparoscopic and robotic surgeries have transformed general surgery. Now we are able to do these with the small incisions, reduce pain, and quicker recovery, and therefore a lot less complications. How have advancement in surgical technology improved the outcomes of these patients?
Immensely, right, Kemal? Because essentially the abdomen is a cavity, right? It's a box. So things happen inside that box, and the surgeon has to go inside that box to fix it. Now, for the longest period of time in the history of surgery, the only way to get into that box was to make a big cut, because we had to put both our hands, we had to get our view, right, so that we can see things. So to do even smaller procedures, relatively speaking, we made big incisions in the abdomen, and we stretched the abdomen, we stretched the muscle, we put big hands of the surgeons inside, sometimes of the assistants as well, with big instruments as well. And that small surgery inside that box actually was accompanied by big trauma of the abdominal wall itself. That was how surgery was done. So to take the gallbladder out, to take the appendix out, to do some other procedures on the intestine, surgeons really had to make big incisions, right? Now, those big incisions cause a lot of pain. They take time to heal, and they are associated with weakness of the abdominal wall. And what does weakness of the abdominal wall cause? Hernias. So hernias were very common in those days. Well, laparoscopy has changed all that, because instead of making a big cut in the abdomen, now we make what we call keyhole incisions, very small incisions, because we don't need to put our hands inside that abdomen now to operate. We just need to insert very slender instruments that we can manipulate. And you would say, well, how can you see what's happening? Well, we have very, very good cameras that are inserted through very slender instruments as well, and that view is projected onto a TV screen. And once we learn how to manipulate things on a two-dimension screen, then we can do laparoscopy. And initially we were doing just gallbladder, and then, as you know, we learned to do very complex surgeries like gastric bypass, for instance, that bariatric surgeons have become so good at. And now we can do very complex procedures through laparoscopy, which means that the trauma of getting inside the abdomen has been completely removed now, and that makes the recovery of the patient that much quicker, right? They don't have as much pain because the cut is not that big. They recover quickly, and guess what? We preserve integrity of the abdominal wall, which means that the abdominal wall does not become weak, which means that the risk of hernias after surgery is much lower as well.
My final thoughts on this is that prevention is the key, because I mentioned earlier the way that we are able to do this case just clean example, the Medicare patients for gallbladder, that's uh, 6 times more expensive in the hospital setting. Now, appendix and others are similar. Now, many young people who are going through these ending up in the emergency because they didn't have the proper actions, and therefore they are gonna cost themselves a lot more. Now, also, emergency. Of course, you guys are all great surgeons, but the emergency surgery is emergency. So you are limited to a degree, and you can be the best surgeons in the world, which our surgeons are. But in the emergency setting versus when we are able to do things in the outpatient setting, in the elective setting, that would be key for better outcome and less complications. Therefore, I ask our patients, our audience, to listen to you and listen to their symptoms, and then act promptly. The doctor visits, even if it starts with your PCP, is that's the key.
Absolutely.
So that's how we need to eliminate a lot of complications and other bad outcomes, because we have technology, we have more advanced surgeons, and this can be a lot less impactful if it's done in the right setting. So please do not delay. So that's all we have for today, Dr. Gao. Thank you.
Thank
I
you.
did
Thank you,
this
Kamal.
with Dr. Wynn and Dr. Peters, and I'll continue to cover this
I
time
think
to time.
it is very important.
It's a good reminder for people, because when we assume that people already get everything from one session, that's never the case. So we will be back with this topic in the future. So we'll be back next week with another session of Bariatric Friday, and until then, please stay united. Bye bye.
Bye bye.